an aggressive form of prostate cancer. Dr. Marc Siegel joins me now. How was this missed, Doctor? The president is surrounded by the best doctors in the world all the time. How did they miss it?
Well, first of all, Stuart, I want to gently say that you just heard from Mark Meredith about how the doctors in the White House might not have been forthcoming on the cognitive slips of Biden. So I don't automatically assume that this was missed. But if it was missed, which is what they're saying, it's first of all, what extensive screening did they do? They should have been doing extensive screening on the President of the United States. I mean, there's some guidelines that are saying don't screen after 80, but I don't agree with those, and I certainly don't agree with those with the leader of the free world. So was he screened? The screening's pretty sensitive these days between a PSA, a free PSA, prostate-specific antigen, checking urine for biomarkers, genetic testing. You would think he'd get a full-court press. They're diagnosing him with pretty advanced stage prostate cancer, very aggressive, a metastasis to the bone already, having urinary obstructive symptoms. This doesn't occur overnight, Stuart, in case you're wondering. Aggressive notwithstanding, it doesn't occur overnight, and he must have had it while he was in the White House.
How long would it typically take for a cancer of this type to metastasize to the bones?
Well, that's a great question. So it goes from the prostate to the lymph nodes to the bone. The bone is the first place that it goes, and he does have only one metastasis to the bone, they're reporting. So that can happen fairly soon in a very aggressive cancer like this one, Gleason 9. And again, it's hormone responsive, so they're planning that, but they may be planning other modalities too. But it's still a matter of several months, in answer to your question. Got to be several months from the time it initiated. Look, 80% of all men over the age of 80 have some prostate cancer cells, 80%. And I think we got to revamp our approach to this because we now have treatments we never have before. And robotic prostatectomy literally can be done without any blood loss through a tiny hole. We got to know if anybody has prostate cancer and what to do about it. We have to be aggressive.
I'm told that 30 to 40% of patients who've been diagnosed with this type of cancer survive for 5 years. 30 to 40% survive for 5 years. Is that accurate?
That is accurate. There's two differences here, though. One is a very aggressive. Again, very aggressive could make that less. But the fact that it's hormone responsive, meaning that that tumor is dependent on the testosterone. So if we block testosterone production, and we got a couple different ways to do that. One is even in pill form now, where you stop testosterone from being made in the body. A lot of side effects, including fatigue, that may prolong his life. So the aggressive goes in the negative column. The treatment, if it works over the next few months, goes in the positive column. But that number is accurate.
What other treatments are there apart from restricting testosterone?
Well, one thing that's really advanced is radiation. I mean, radiation oncology, they may decide to radiate that lesion in the bone. You know, they can use targeted radiation. They can use seeds. They can use radiation. They can even try to remove it. They could still do surgery and then add the hormone therapy to that. So there's a lot of different approaches here where they can do two or three more different things here at the same time. There's immunotherapy, there's chemotherapy, but they're going to start with this hormone therapy.
I'm just getting this. Zeke Emanuel thinks, and he's in a medical field, obviously, he thinks that this probably started in his presidency in the year 2021, all the way back then. What do you say to that?
Well, first of all, Zeke Emanuel, politics aside, is actually an oncologist. So this is his field, and I think that that's possible. This can be very slow growing for a while and then pick up steam. I'm pretty sure it started in his presidency. I don't know how he knows what year. I wonder where he got that year from, but clearly it started in his presidency. I don't think there's any question about that.
And we'll leave it right there. Doctor, thanks very much for joining us on a difficult subject. Thank you, Doctor. We appreciate it.